Good morning. I'm Dr. Suresh Kaul. I head the Department of Cardiovascular Sciences here in Amandeep Hospital, Pathankot. I've been working here for last 7 years now. I'm a DM in cardiology, a fellow of American College of Cardiology, a fellow of European Society of Cardiology, and I also am a fellow from Society of Cardiovascular Angiography and Interventions US. I'm also supported by a very efficient team, which is I have a senior interventional cardiologist, Dr. Neelam Kaul, a cardiac anesthetist. We have a cardiac surgeon, Dr. Bhavna, and we have been working here for last 7 years now, and have been delivering tertiary cardiac care to the one of the remotest areas of the country. Uh, we serve almost 50% of Himachal, uh, peripheries of Jammu, Samba, Kathua, and Mukeria, Gurdaspur, and the these areas of Punjab. We are kind of centrally located, and it gives us, an opportunity to serve people of all the three states. It's really great working here at such a peripheral place where we are delivering healthcare to kind of a semi-urban and rural populace primarily, and costs are also not that high. You see, as a doctor, uh, I think our main aim should be focused on prevention. That is, our aim should be to educate our population so that they make certain lifestyle changes by which the disease doesn't occur in the first place. That is, there is a misconception that people will start getting cardiac disease or heart blockages at the age of 50, 55. That is rubbish. You see, we are seeing heart attacks at the age of 20s and 30s because the lifestyle has completely changed. Uh, we have gone from our traditional values, uh, and the kind of diet that we used to have. It was jawar, bajra, and crude atta, and from there we're going towards refined. We took all the Western lifestyle along with diet, but that was minus exercise. Now those guys do a lot of exercise. There was a study in which they found that if when they picked up people from India and Japan, where the disease was low at, they picked them up and put them in America, US. Those guys got disease earlier than the people who were locals there in US and Europe. So our genes are meant for starvation. We were not well-fed countries, so we should eat less and work more. And even if we have inculcated Western lifestyle in our daily routine, it's very important that we should exercise. I think moderation is the key word. That means there's nothing like you should not eat this and you should not eat that. You have to be moderate. A little bit of alcohol, I would say no to smoking, and fat free, little, no, less. It's not that you should completely have a fat free diet. There has to be a little fat because fats are also important in absorption of vitamins. So it's not that you can completely banish some supplement from your diet completely. It's not like that. Moderation is the key word, and with exercise. Then, see, once our body starts getting old, it needs regular checks like our vehicle. Well, first they'll give you first three services free of cost once you take a new car, because they know a new car is never going to have a problem. But once you start getting towards age 40, that is the time you have to become aware, my body is getting old, I need to get regular checks. So what are the checks? Somebody will tell you that you've got an ECG which is normal. Doesn't mean that you are absolutely normal. What we need to find out is that whether your ECG is normal when you walk and do exercise. So that is known as a treadmill test. So you should always consult your doctor and ask him, what should I get? So as soon as you touch 40, you should start getting yourself examined. At the same time, there are some populations who need to get themselves checked earlier, like a diabetic. If you have family history of diabetes, somebody has died of a heart attack in your family, those people need to go early to a doctor and get themselves checked. I would say at 25, 30. Let's say that somebody has got a pain in his chest. So what kind of chest pain is usually a heart attack? So any pain which comes like this in the whole of your left chest, and it goes to the arms, goes to the upper jaw, goes towards this side. and it will not let you breathe. They say in our books, they used to call it a sense of impending doom, that I might die. And you walk 2 paces, you feel you're going out of breath, you would like to sit down, and it'll be one of the worst pains that a person has had, besides that renal colic, stone wala pain. So this is really unbearable. And if you are in that age group, what can you do immediately? So first of all, start taking deep breaths. That means what you call pranayam. Do a little pranayam. And I think all of us should have aspirin, Dispirin tablet at home. And those people who are at risk, like diabetics, they should carry one in their pocket. So pop in an aspirin, chew it, and take it, and see the nearest facility, and get an EKG done, ECG done. There's another misconception. There's an artery, the right coronary artery, which dips into the lower side of the heart. The pain can come here on the epigastrium, that is on the upper part of the abdomen. Now, upper part of abdomen pain, most of the times we have seen that these patients are referred as, they are treated for acidity for 2-3 days till the time they go in shock. Blood pressures are unrecordable. Now, these patients who have pain in the epigastrium or pain in the upper abdomen, and if it is not relieved by anything, kindly tell your doctor or whoever is seeing you to get an ECG done. It might be an inferior wall MI. That means heart attack of the lower side of the heart. So we have seen catastrophes happen in families when it was not diagnosed in time, just because an EKG, a basic electrocardiogram, was not done. It would have picked up, timely treatment would have saved the patient. Are there instances when you don't have pain? Yes. Patients who are elderly, who are more than 65 years of age, patients who are diabetics, who have sugar, they can have pain, no pain, and still have a heart attack. So how will they present? They will say that I used to walk, you say 3 kilometers a day, and now I'm not even able to walk 3 paces. This is known as fatigability. So if a diabetic has sudden fatigability, you should be thinking that there may be some heart problem. Or if you have breathlessness, you used to walk normally and suddenly you started feeling breathless on walking. There's no chest pain. Still then you can have a heart attack. And one more thing is that that is nocturnal cough. That means if you start coughing in the night, your whole day you're okay, and in the night when you go to the bed, you start coughing, and then you get relieved or you get breathless on lying down, and then you sit up at around 12 o'clock and then become better. These are also signs of, I would say, advanced cardiac disease, and they need to be taken seriously. You should consult a physician or a cardiologist as soon as possible. Many times we have had patients who come to us with a heart attack, and they tell us that we had got a TMT, that is a treadmill test, done maybe 2 weeks back. And why did they have a heart attack when a TMT was negative? Now, treadmill test, that is walking on the treadmill and doing an ECG, which is known as the stress ECG, will be positive only when there is more than 50% blockage in an artery. Now, if you have a 30-40% blockage and the flow is okay in the artery, you can have a normal treadmill and you can still die of a heart attack. Because it's not only the percentage of the degree of severity of the blockage which causes a heart attack. That's what happens in young males. We had a patient who was just 24, was somewhere around from Dinanagar. He used to take drugs, and the whole right coronary artery got torn because he had consumed drugs. So in younger population, I would say, we very angry. We become angry at smaller. Our tempers are not in control. We are having stressful lifestyles, and then on top of that, we consume everything in the world which is detrimental or harmful to the heart. That means, let's say you had a fight with one of your colleagues, and in the evening you go and puff, say 12 cigarettes, take a drink, and suddenly at 12 o'clock you had chest pain, and you thought, I'm just 24, I cannot have a heart attack. Now everybody is at risk. I think the prevention has to start as soon as you are born. And coming to blockages, there have been instances when people say, stent dal diye. This is the common language that people use. But I think you should be thankful. I think stents, angioplasty, balloons, and stents have been the discoveries of the century. Why? Because people who used to die of a heart attack, 50 years back, when people used to have a heart attack, they would be cooled off. They would be kept isolated in a room, not allowed to walk, and they would be sitting for 1 month. And then treatment went on to steroids and then the blood thinners. Ultimately, this mechanical revascularization, that was opening the artery, came up, and it must have saved lakhs and millions of lives. And the credit goes to Dr. Grunzig and people before him. Not many people will know that there was a doctor who, while experimenting it is in 1950s, while experimenting on his own heart, that he wanted to want to deliver drugs to the heart, he lost his own life. The people have given up their life for the sake of mankind. And we, sitting here in the subcontinent where not much research is going on, start commenting on people that everything is financial. It's not. Everything is not financial. There is a young 30-year-old gentleman who comes with a heart attack, and the family outside is sitting. There are 3 children. There is a wife, and all of them are praying for him. When we go inside, see 100% clogged artery, we open it and then do PTC, angioplasty, and stenting, and he survives. And then outside, somebody comes and tells, "Dal de stent." This is very, very wrong. I think you got to see the circumstances in which doctors are working. Not many people will know that when we do angioplasties, that means we operate on hearts, it's done under fluoroscopy. That means when I go inside to operate a heart attack patient, I am taking radiation to save somebody else, and this radiation can give me cancer. Now, what more philanthropic can be? This is height of philanthropy. Dedicating your own body, own self, knowing that you can still get cancer from radiation. We are going in with radiation suits which are not 100% immune. Still, then you're doing good work. Now, leave aside those people. There are blacks and whites, but please have faith in the profession. There are a lot of good people in the profession, and they are doing very good work. Leave aside those people who are doing. We are not interested in those people. God will take care of them.